Welcome to Ross University School of Medicine's Procedural Skills IV Phlebotomy Lecture Presentation. I'm Dr. Brenton Otey, and I'll be guiding you through this lecture. Before we get started, let's discuss some of the objectives for this lecture. We want to provide students with an overview of IV cannulation, review the major blood vessels considered for IV catheterization and phlebotomy, and provide basic considerations for phlebotomy tubes and tests. Let's discuss the major veins in the hands and wrist. There's three major veins we can pick from. The dorsal digital veins, indicated by number 1 on the image, the dorsal metacarpal veins, indicated by number 2 on the image, and the dorsal venous network, indicated by number 3 on the image. The dorsal digital veins, which are found along the lateral portion of the fingers and thumb, are generally a last resort cannulation site. The dorsal metacarpal veins are found between the metacarpal bones on the back of the hand and can accommodate 24 to 20 gauge cannulas. The dorsal venous network is a union of the metacarpal veins on the dorsal aspect of the forearm. It can also accommodate 20 through 24 gauge cannulas as well. Now let's discuss the major veins in the forearm. The cephalic vein shows up as an option that you can choose from in two different locations, starting with the more proximal section of the cephalic vein located within the antecubital fossa, indicated by the number 1 on the diagram. For number 2, we have the median cubital vein, which is also commonly used to draw blood. It's also a choice location for trauma or shock patients, as it can accommodate a catheter with a larger gauge, which would accommodate for a larger amount of flow. Number 3, we have the accessory cephalic vein. We have the basilic vein, indicated by the number 4, the more distal section of the cephalic vein, indicated by the number 5, and the median antecubital vein. Now that we have reviewed the associated anatomy of the arm, hand, and wrist, we can discuss the process of vein and site selection. When choosing a vein, visualize the upper extremity blood vessels. Look for round, firm, elastic, and engorged vessels. You can also use a tourniquet for guidance. The tourniquet will make the veins more pronounced and easier to identify. Try to avoid using veins that are hard, bumpy, or flat. And you also want to avoid veins that are covered by areas of bruising. They're in an area of inflammation. They're covered in skin disease, or the skin is injured or broken. It's in an area of sclerosed or thrombotic skin, or the skin appears to be tortuous. When choosing a site, there are multiple things to consider. Generally, the non-dominant hand is preferred, but it's always a common courtesy to ask the patient which hand they prefer. You always want to start distal and move proximal in the upper extremities. If replacing an IV cannula, look for a site above the previous site. You should also palpate for arterial pulsations, making sure that you avoid the arteries. Make sure to avoid the lower extremities, as they're generally only used for emergencies. Areas of flexion, as they are a high movement area. Avoid hands and joints of people using crutches or walkers. Previous cannulation sites, areas of poor venous return, or AV fistulas, and also areas of lymphedema. Here is a chart representing the gauges of the cannulas and their associated colors. The majority of your instrumentation needed will be contained within your IV starter kit. This should include your tourniquet, a sterile draping, antiseptic swabs, a transparent dressing or tegaderm, your sterile tape, gauze sponges, and safety positioning device. Other instruments also include an IV extender tubing with injection cap and a lure lock, your clean gloves, scissors, IV cannula, a vacuum tube hub, your blood collection tubes, and a pre-filled syringe containing your normal saline. Here is another chart you may find useful to familiarize yourself with the different types of blood collection tubes and their associated stopper colors. The pre-procedural steps are important to ensure the blood samples can be taken effectively and efficiently. There are 6 we're going to discuss, and we're going to start with preparation. Prepare the supplies at bedside, remove any restrictive clothing on the arm, and make sure there is good lighting. Open the IV packaging kit, prepare the tape, flush the cannula end of the extender with saline, keep the saline flush connected to the cannula and IV extender, and then of course, put on your gloves. Place the tourniquet on, placing the tourniquet proximal to the insertion site about 10 to 15 centimeters above. Make sure that it is tight enough to occlude venous flow. Then you're going to inspect and palpate for veins, preferably distal on the non-dominant hand. You will then clean the site using your antiseptic swabs. Clean the area using the friction in a circular motion, starting in the middle and then rotating outwardly. This will minimize the risk of reintroduction of bacteria to the planned insertion site. Now you're going to check the catheter and the needle. You will start by removing the cover of the catheter, grasping the plastic hub. Make sure that the needle bevel is facing upwards. Do not touch the needle part at any time. Then, apply traction. You're going to apply traction distally from the site with your non-dominant hand. Pull the skin taut and hold it. Warn the patient of a sharp, quick stick. And with that, you are ready to obtain your blood sample. Insert the needle, making sure that the bevel is pointing upwards. Insert it at a 30 to 45 degree angle, maintaining a steady angle throughout the whole process. You'll then attach the vacuum tube holder, keeping the needle stable throughout the process, as moving the needle will yield pain or discomfort to the patient. Connect the blood collection tube to the holder and obtain your sample. Using the other hand, remove the tourniquet when the last tube is filling. Retract and remove the needle. Once you are finished, retrieve the needle and dispose appropriately. You will then apply pressure using a gauze and a Band-Aid as needed. It is important to label the tubes immediately. Make sure the order labels are on the correct tube as well. They should include the patient name, identification number, their date of birth, date of draw, time of draw, and the initials of the person that drew. Some other things to remember: stat orders should be rushed to the laboratory. Some samples may require a specific amount of blood to fill the collection tube, and also remember to invert the collection tubes as needed. Now, there may be some cases where the tubes that were sent in are rejected. Some tubes may be rejected for the following reasons. There could be a discrepancy between the label and the request form. The specimen itself might not include the patient's name or appropriate identifiers. The specimen could potentially be too old or have coagulated. The specimen does not meet the required amount of blood within the tube. There are also a variety of interesting biomedical devices which can assist in the process, like this AccuVein vein finder, for example. Now, if you find yourself to be more a visual learner, we have 2 slides of supplementary videos at the end of this presentation.